My name is Álvaro Reyes. I'm a nephrologist. A nephrologist will take care of diseases of the kidney, including the causes of those diseases like high blood pressure, diabetes. Those are the two most common diseases that will end up or may result in kidney disease. But of course, there are a number of other conditions, such as kidney stones. Kidney stones are very prevalent in this area. They are northern Kentucky and Ohio and Indiana are part of what you would call the stone belt, suggesting that around this part of the country, kidney stones are more prevalent than in other areas. It's difficult to know if that's due to environmental issues or dietary problems or a combination of both most often, along with most likely a genetic or familial background. Seeing a patient in the St. Elizabeth systems is one of the best aspects of my practice that I have been able to enjoy over the last few years, because the communication with the primary care physician and the patient is streamlined. The evaluation done at my office is available immediately to the primary care doctor, and if the patient so desires and the family so wants to do it, they also have access through my chart to our thinking and the plan and the coordination. So not only we may be doing the best care for that patient at that moment, but also the other many moving parts of the care. I dread to see patients that come by themselves, and especially men. And I don't dread to see family. The more family members I see, even the better. And actually, I enjoy seeing the 8 and 10-year-olds because they are sometimes like the police. So sometimes you see a patient that you need to ask, does he eat salt? And the patient says no, and the 8-year-old says, yeah, you eat this, grandpa, and you eat that, grandpa, which is very salty. So at that moment, I actually stop talking to the patient and just turn to the kid and say, from now on, every time you see grandpa doing this or doing that, don't let him. And next visit, if the little one comes, you can tell that the patient changed the behavior because of the input of the grandson. So family is very important to enforce sometimes modifications. So the benefits of a patient coming to St. Elizabeth physicians is that they will have access to many physicians with different levels of expertise in different areas. And if the case determines there is a need to get others involved, and that is often the case, we have the access to that person right away. So education of the patient will involve dietary restrictions. They really need to work close to and with the primary care physician. The other help that we have, including dietary services and social work. And I always tell my patients that they also need to pay taxes, go to church, and do good work.